Welcome, team, to the very first episode of Plastic Surgery Untold, Beyond Botox and Butts. I'm Dr. Johnny Franco, board-certified plastic surgeon, also known as Austin Plastic Surgeon. I have the great privilege of having two incredible co-hosts here. Number one is certified registered nurse anesthetist, and we'll get into what that is later, Travis Osborne, also known worldwide as Celebrity Anesthesia. And then we have the fabulous and stunning Megan Parkin, who doesn't need an introduction, but we'll do it anyway, social influencer and relationship blogger. Travis, maybe let people know how we got to know each other and a little bit about you.
Yeah, man. I am a certified registered nurse anesthetist. I actually do anesthesia here in Austin, Texas for a group of plastic surgeons. I get to work,
including me.
I get to work with this guy, one of the best in the world, maybe a couple times a week. A lot of times we're in the OR with not much to do besides the cases, and we'll start talking and kind of come up with ideas. And this podcast was one of those, and here we are.
Just so people know, and this is how Megan and this came to about, is that we do a lot of stuff on social media, Instagram, Snapchat, where we try to make it very educational for people, but it's very snippets. And so producer Donald, who you guys will meet later, has been pushing me to do something that's a little bit more extended view of this. And Megan being a social influencer throughout, we thought would be a great mix to this. One, to keep us real. Two, to kind of help this going from a different perspective. So if we get into some medical jargon and get out of control, she can rein us back in. Megan, thoughts?
Definitely. So I think I can kind of bring a personal aspect to this. I'm a recent patient of Dr. Johnny Franco's, and I think something that kind of makes him different from other people is that you are so open online about the whole procedures, how it goes, the recovery, everything like that. So I've been sharing my journey a bit on there, but I think this is a place where we can dive a bit deeper into it.
And if you don't mind me sharing, so today's topic is actually breast augmentation, breast implants, which is the number one aesthetic procedure in the United States. It's been that way for years. And so we'll talk a little bit about it from start to finish. And I think you're going to kind of keep us in the middle and kind of tell people your personal side. And I think people are really going to like hearing the other side, because it's easy for me to say that the recovery is fast and easy. You may or may not agree.
And I will say, personally, you have not had this breast augmentation done, so you can't quite speak to it as I can. So that's.
I mean, I've thought about it. I've also considered calf implants, but we'll just have to see what 2020 brings.
Next year, new year, new me. Full of pec implants.
Quickly approaching.
Well, if you guys are down, let's get this show started. Let's talk breast augmentation here.
Let's do it.
If what we'll do here is I'll give you my cliff notes of what I typically tell people when they come in about breast augmentation, so that we can kind of have a foundation, and then we'll maybe go through some questions. I'd love for you to touch on the anesthesia of breast augmentation. I know that I always worry when I'm going to get my breast augmentation whether I'm going to wake up during the surgery, and I think maybe you'll touch base on that a little bit later.
We can touch on that, yeah.
So breast augmentation, it's become so popular for a couple reasons. One, there's a lot of people who just want to either enhance what they already have, or we have the second group of people who have maybe deflated breasts from either weight loss, which is I think one that people forget a lot about, and I think people work really hard to enhance their body to become a little bit healthier, and then unfortunately the breast can deflate, and then they want to restore that. The second set is our moms out there who breasts get engorged and full, and then unfortunately deflate after pregnancy and breastfeeding. So I think there's a lot of people that it hits home to. I think that we've also been able to get to a good spot with breast augmentation where people tend to recover fairly quickly, and so the system has become pretty streamlined, and which I think makes the recovery and the results very, very good for people. Second, breast implants have come a long ways. The new gummy bear implants give people a chance to have a full and youthful look without that overly fake coconut look that people were really afraid of.
Yeah.
I think lastly, the hardest part, and this has gotten better with a few things, is figuring out the size that people want is extremely difficult for people sometimes. In our office, we typically have people come in, size for a while, look in the mirror, I like it or don't, and then go from there.
Yeah.
People will say stuff like, I want to look subtle, I want to look natural, bring me a picture right off a porn site, boom, 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 that's fine. Different terms of subtle.
Nothing like subtle from a XXX website.
Hey, Megan, maybe help us out here a little bit. I just want to give people a little bit of a rundown, but maybe you can lead some questions, some issues, some thoughts you had, so we can touch into a few more topics.
Right. So when someone is kind of considering getting a breast augmentation, what's like the first step for them? Obviously, coming in for a consultation, because what someone thinks might be be what they need might not end up being the solution to their
No question. I
particular
think
problem.
from our standpoint, that's a part we forget about. One, do your homework about where you're going to do a consult. We're fortunate here in Austin, Texas. There's a lot of just incredible plastic surgeons. You want to see a board-certified plastic surgeon. I think that while I love social media, just because somebody has a great Instagram doesn't mean they're a great surgeon.
Good point.
Two, so doing a little bit of homework on that. Three, looking at people's before and after pictures because you want to see something that relates to you because people tend to do what people do. And so if you like that work, chances that you're going to be happy are good. If you don't like what they're doing, maybe not a good fit for you. And there's a lot of good people that just aren't a good fit. So I think that's one. I think no question a lot of people come in and they may think they need a breast aug and really they need a breast lift. Sometimes people need a reduction. No question. This is where you're seeing a board certified plastic surgeon is going to help you because they're going to guide you along this journey. And I think you made the point earlier about it being a journey, and it truly is. And that's part of picking someone who's going to relate to you because there may be little bumps along the road, but you got to work through it together. You also got to be able to communicate in what your actual aesthetic goals are because that's super important.
Yeah, and I think the thing for me is obviously you want to go in as a patient being super honest about what your expectations are, what you want, but then also having a doctor that's really honest as well is incredibly helpful. You're going to tell someone, hey, that's going to look really good, or, I personally wouldn't go that route, but at the end of the day, it's your choice. And I think that's a big thing that people need. And there's kind of a fine line between feeling comfortable, but also having someone tell you, their opinion when they're a little bit more qualified to do so.
100%, because we can talk about things that we can do and can't do, and that's where I love the pictures because sometimes people will bring something in and I'll just be like, nope, and they're like, what do you mean no? I can't do that, and so it's better to have that discussion before surgery than after.
Or day of, yeah. I totally agree with that because we see that at the surgery center quite a bit. Oh, hey, let's change the game plan day of. Like, that's a lot harder than in your office and when they're doing the pre-op and stuff. When people are there for a pre-op, what options do they have? What types of breast augmentation are available?
I think there's a couple things. One is whether you need a breast augmentation or a breast lift. So I think, and a lot of people get a combination of augmentation and lift, especially if you've lost a lot of weight, especially if you've gone through pregnancy, have breasts that are deflated. So that's one, is figuring out what surgery you need. Number one. Two, if you just need a breast augmentation, I say just, but because we're not doing a lift, it's not that easy. But
don't sell yourself.
And so just to cut in, just so people are kind of clear on this, a breast augmentation actually refers to an implant going in. Whereas it doesn't necessarily, you don't always have to put in an implant if you were going to reconstruct and do a lift maybe.
Correct. So breast enhancement typically refers to an implant, and we'll get into our implants in just a minute, but you can do some stuff with fat transfer in breast reconstruction. There's some fancy deeps and other stuff that we can do, but I think we're going to get into breast reconstruction in another episode, so I don't want to derail us a little bit. But to your point, there's a big kind of category of breast enhancement, but for the sake of today, we're mostly talking implants. And then rolling into implants, the most common implant I do is what's called a gummy bear implant, and I think people get confused thinking this is a completely different something, and that's not true. So gummy bear basically got the nickname because it's a highly cohesive silicone gel. And the idea is where it got this name, if we were to cut this implant in half and hang it upside down, the gel would just stay there. And so that's why it got that name gummy bear, just like the gummy bear candy. And the benefit of that is it decreases rippling. If you were ever to get a leak, the gel sticks together. So that's why it's become so popular. And you on the podcast, you can't really feel this, but I'm squeezing them. The gel implants are just much softer, so you don't get that overly round, fake appearance that with the saline implants people used to get. You also get a lot more range of freedom in terms of sizes because of that soft, natural look. So I think that's super important.
Avoiding the Baywatch look. Is that what you're saying?
I'm not going to not say that. I think the other thing with breast dogs is there's different ways to put them in. Sometimes people put them through the fold underneath the breast, sometimes around the areola, and sometimes through the armpit are the three most common. I wouldn't necessarily say that one is better than the other. I think there's certain patients where one approach is better than the other, depending on your specific needs.
And I think that's part of finding somebody that is good and it's going to be honest with you, that you can ask those questions to, what's going to look best for me? Is it going to be a periorelar, or that means around the nipple, or is it going to be an inframammary fold, which is what you were talking about below, which is below the fold of the breast?
And I think something that I've noticed is ever since opening up about obviously my experience with this, I've been pleasantly surprised by the response. There really hasn't been any negative stigma attached to it. But the one thing I have gotten a lot of questions about that I did want to ask you a little bit about is to dive a little bit deeper into breast implant illness. I know this is really a hot topic going around. And I know even when I briefly mentioned, my journey in my video, I got a lot of comments about that, asking if I was nervous about it, what I knew of it, and what really entails.
I think that's a great question, and maybe producer Donald will put this in for an entire segment on its own. So I think we'll do a little Cliff Note stuff, but no question, I think this is a hot topic and more than probably we can cover today. But let me give you kind of the summary that I'll tell patients. Number one, nobody knows, okay? Breast implant illness right now is this entity that's not a true diagnosis at this point. And so I think it's really hard, and that's why it's a difficult topic to talk about. I think that's why currently there's no way to diagnose this, as this isn't a defined entity at this point, okay? Most people, when they're referring to breast implant illness, are referring to this entity where people can feel fatigued, they can feel like they have a little bit of brain fog, they can have body aches, and you can see where with this, there's a lot of vague symptoms that may be coming from different things, and unfortunately becomes a diagnosis of exclusion currently, where most people have been worked up, had other things, and have kind of come to a point where they're not sure what else is causing this. I'll tell you, there's no one test. I can't send you for a lab test to know if you had this. So unfortunately, most people who are worried about this end up having the ear implants taken out and then, may or may not get better. One of the things, and again, this just goes to what I've seen and from conferences and everything else, some of the theories out there right now about breast implant illness is this. One, it affects less than 0.1% of the population, if you think about it. There's millions of breast dogs every year. Knock on wood, I fortunately have never had one of my own patients come back and have these type of symptoms. Second, some of the theory about breast implant illness, and again, this is my theory, and from talking to other people and some people who we've had these discussions with, is that everybody forms some scar tissue around the implant, okay? And you form the scar tissue because your body just makes this, and this is whether you have a knee replacement, you have an implant, okay? I think some people get maybe some microbacterium, not enough to make you sick, but enough that your body starts to fight this. And I think that's what people could get, some fatigue and some other stuff. So I don't think it's actually the implant. I think it's the scar tissue around it. The one thing I would say is there's still a lot of work to be done on this. Right. I think it's really hard topic. I definitely think there's a lot more to come on this, but something you should absolutely talk to your physician about.
And I think, we've touched on it before. I think we're going to set up a separate episode where we dive deep into this and maybe get some other people on here too to help us dive into this topic, because it is very, very dense stuff. So.
Yeah. What other questions do your fans ask you all the time?
So a lot of people were wondering about recovery, and I think that also depends on obviously what you're doing, how you personally are active, you're not active. I know you told me a little bit about that before, and it kind of really varies from person to person, but...
Definitely varies from person to person. Depends whether you get a breast augmentation or a breast augmentation and lift. I think with a breast augmentation, most people can have this done on a Wednesday, be back to a desk job on a Monday. Most people feel a lot of pressure on their chest, like somebody's sitting on their chest and those type of things. Is that what you felt?
Definitely, yeah. I would say more than pain. If anything, it was just a little bit of pressure.
Being the pain guy on this panel.
Well, please let us know.
I always tell patients, when you wake up, you're going to feel like a tiny baby elephant sitting on your chest. There's not any amount of narcotic in the world that I can give you that's going to take that pressure away. And that is really just from that stretch sensation of the implant sitting in a pocket that you've created. That may actually be a good time for you to talk. Could you explain in a nutshell what a breast implant, when you put it in, how that procedure actually comes to be?
Yeah, so if we're talking about like an inframammary fold breast augmentation, which is the most common in the United States, basically there's a 3.5 centimeter incision at the fold underneath the breast. The reason that this becomes so popular is you actually miss all of the breast tissue. You slide underneath the breast tissue, you actually get right underneath the pec major muscle, and this is why you feel that tightness as you're lifting that muscle. You actually get into a nice natural space, and we can open that space. We use a sizer, we do a bunch of things. If you guys want to see these at Austin Plastic Surgery, we show these all the time, to give myself a plug. And then we can sit people up, take a look at, make sure everything's perfect, take the sizer out, and then we actually do some things as we touched about, this capsular contracture. We wash the pocket out with antibiotic solution, betadine, use something called the Keller funnel stuff, put the implant in its home easily.
If anyone has seen your Instagram channel, they know what the Keller funnel.
They know I
is.
love the Keller
That's your
funnel.
favorite part.
And the implant goes in there. And so I think that's the process of its whole. I have some questions for you, but just to wrap up the recovery, if people do get a lift with their augmentation, people do need more about a week to 10 days, just because depending on the type of lift, and that's a topic for another day, you don't want to open up those incisions. You want a really good chance to heal. I do tell people, whether it's breast dog lift, if you prepare and have people to help you and take care of you, you tend to do well. People who do too much, don't take this seriously, tend to have problems. Plan this out. Think about it. I think it's super helpful. Yeah. The other thing that's been super helpful, and I actually changed this in my practice because of you, is how we deal with pain. And so we've actually changed, and we actually get people started on some things prior to surgery. There's some things differently that you're doing during surgery, and these stem from you. So would you like to maybe let the people know what your brainchild is?
Sure, yeah. And I cannot take any of the credit for this, except for putting it together and kind of doing some research on my own and being involved with some places around the country that have been really good in this. But early recovery after surgery is a huge push in the U.S. right now. We're dealing with an opioid epidemic. Opioids are not great drugs. They have super high side effect profile, and they're addictive. So we do everything we can to limit.
It's rare that people get addicted if you just take your initial prescribed stuff.
Completely
in
agree.
Pain, the first couple of days, people are fine, because that's a fear that I get. But it's when people go beyond this.
It's when people go beyond this, and it's when people go way beyond it.
Right.
It's not a typical thing at all. But we try to employ some other things. We have patients start on non-narcotic drugs preoperatively. We have them take medications the morning of surgery. I do a few different drips during the surgery that are non-narcotic, like ketamine infusions and magnesium infusions. We use some Presidex, just other drugs. If you guys are interested, I can define those at a later
Megan,
date.
feel free to jump in and rein him in anytime. Rein him in anytime.
I mean, all I can really say is I know that I was not in a lot of pain, and maybe I'm just super tough. But I think so far my recovery has been pretty breezy.
I mean, I'm not gonna disagree with this, but I do love that if somebody recovers well, they're tough. If they don't do well,
it was
that
my fault.
anesthesia.
Oh yeah, it's always me.
But I do think starting people on medications the day before, getting them some baseline coverage, some anti-inflammatory, some other things, because it's not just the pain that helps, right? Staying away from narcotics decreases their nausea, makes the recovery a little bit easier. People don't have that hangover feeling. Correct me.
They don't have that hangover feeling. They're not going to get itchy, which is a known side effect from narcotics or opioids. And then they're also not going to get as nauseous.
But when I had my knee surgery, my biggest thing was the nausea. And so I actually didn't even take many because it just became worse than the pain.
And what's nice, I mean, we've had a good bit of patients that we've done without using any narcotics on breast augmentation, and that's pretty cool.
I think it's been great. We've seen in our office a huge change from people in terms of their recovery, how they come in feeling the next day.
Absolutely, much more lucid and just able to get up and walk around the house.
To make its point, there's still always going to be a spectrum. Some people tolerate stuff better than others, but I think as a whole, we've moved in the right direction.
Right, and I think a lot of it also, like you said, just being prepared, understanding that this is a surgery, this is something you want to be obviously prepared with all your medication beforehand, have someone there that's, trustful and a responsible person to help you out, and just kind of have it all set out. So once you do get out of surgery, you don't have to do a ton, and just you can kind of relax.
Can I ask you, Megan, a question a little bit? Because I've seen a big change in my practice. It used to be that people brought in pictures of their favorite celebrity in terms of what they want to look like, wish pictures, if you will.
Right.
I feel like now it's their favorite social media influencer, and maybe your thoughts on how social media has impacted. And I don't want to go too crazy into plastic surgery because I feel like that's a great topic for another day. But at least in your breast augmentation journey and so forth, because it's out there.
Right, for sure. And I think also, at least from my personal experience, I can say that, people that have followed me for years, they've grown up with me and they kind of knew what I looked like before. So they were aware. I've also always been very open about, I always had a larger chest. I went through a period of going off and on birth control, shifting in weight and stuff. So I think the fact that people can look to someone on social media or someone that they followed for years versus a celebrity, they maybe know what the starting point was and they know what this person looked like, preoperatively, and that can be helpful in a guide to what they look like after, and then using that as a way to kind of shift what they want.
And to that point, you actually lost a lot of weight, and that's what stemmed some of this for you,
Right.
correct?
Yeah. And I think also, in terms of a lot, for me it was around 15 pounds or so, which, to a lot of people maybe isn't a lot, but on my frame personally, I feel like I very easily show or, gain and losing weight. So for me, it was enough to make it something that I wanted for myself,
In 15, 20 pounds, I tell people typically will make a change in your breast size. Because I think what people forget is you have the glandular tissue, but then you got fatty tissue around you that changes just like your face would, your belly would, your butt would, with weight gain, weight loss. So,
and I feel like a lot of women even notice that, when they start to gain weight, they notice it in their breasts, as well as when they lose weight, that's where they notice it. So
the other part of social media that maybe you and Travis can both touch on is Travis has a celebrity wife on Instagram as well. So we'll talk more about that a little bit later. Her and Megan are actually kind of nemesis. So we may have to have that out on the podcast one of these days. But we'll save that for another day. Because you're very open and you're very transparent about your life on your social media. But unfortunately, I feel like a lot of people post pictures that aren't true, that are photoshopped, that are edited, and then people as a large think that that's the norm. And sometimes that's a big part of our consultation is what's real, what's realistic, what can I do, what's just not true.
Right. And would you say also for you, you have all the videos and stuff, obviously you can't Photoshop a video. So when you're showing that, I think that's also a good resource for people to see and tune into.
No question, people who watch our stories tend to have a better consultation because they already know what's going in. I think a lot of times when I tell them why they can or can't do stuff, when they've seen this, they're like, oh, that makes sense. Yeah. You took my breast apart. I should chill out for more than a day.
Absolutely. Right. When you see someone have a mastopexy, which is a breast lift, you see that's a lot of tissue that you're opening up and you're reshaping and you're cutting out. Well, that's got to heal, and that the body needs time for those things to heal. And when patients get a chance to actually see behind the scenes, that's huge.
Megan, as someone who's gone through this, what would you say are the top 3 things either you were surprised or wish you had known or tips you would tell people when they're looking for a plastic surgery? I know we talked about this, but trying to kind of bring stuff back at home for people.
I would say back to what you said about sizing. I think that was really interesting. I know, obviously, when I came in the first time, I tried on some different sizes, kind of thought I wanted to go bigger, came back in the next time around, kind of wanted to go smaller. And I think you said that's pretty common. People feel a little bit torn sometimes between what they do. But for me, I'm really satisfied with where I chose. And I think, immediately after surgery, you are swollen. So I even felt a little bit bigger in a way. And I was like, oh my gosh, maybe I did go too big. But now as I've kind of settled a bit, I'm, very pleased with that. So
I think that's a great point because, and Travis can speak to this too, but it's so funny because everybody goes through the cycle of I'm too big, I wish I'd gone bigger, and I love them. And so, whenever somebody brings somebody to the consultation or post-op, I'll tell their significant other, whoever's with them, remind them of this because everybody goes through this segment.
Oh, yeah.
Yeah, and I think, again, also just doing your research is important, like you said before. Kind of understanding what is actually going to be happening to you is something that I think is good knowledge to have and can help you, obviously, recover and heal the best way possible. And then lastly, to just know that at the end of the day, if it's something that you think would improve your own confidence, do it for you. Don't do it for a guy. Don't do it for any other reason. Don't feel pressured. But if it's something that bothers you, I think there's no harm in coming in, having a consultation, and seeing what your options are.
100% agree because a lot of times when we do consultations, most of us tend to I tend to talk to people about why their goals are and what they're trying to do, because I think, to your point exactly, if this is for you and just something you want to do, people tend to be super happy. And it's funny because Travis and I joke about this in the OR. You can tell whether people are going to be happy with the surgery before we ever do the surgery. And it's because if they're doing it for the right reasons, they tend to be happy. If you're doing this to save a marriage, if you're doing this for a boyfriend, you're doing something like that, I'm going to be real with you. You're not going to be happy, and it ain't going to save your marriage. Breast implants are not going to make any difference if somebody's cheating on you, if somebody's, trying to leave you. This is not the answer.
Yeah.
And at the end of the day, it's important to address that,
Absolutely. Yeah. But I think that's also about finding somebody that is going to be real with you, a good board certified plastic surgeon like yourself that's going to have that real conversation and that difficult conversation up front, to not just, lead you astray and say, yeah, we can fix anything and do anything. You want somebody that's going to be realistic with you.
Any last topics as we sum this up that you guys want to hit home to your fans?
I think just go in prepared. Do your research, but then also sit down with the plastic surgeon that you're gonna go with, and really get to know them and let them get to know you, and come up with a plan together.
Yeah, I think for me, honestly, back to the point I made earlier, just do it for yourself. Do your research, make sure you're knowledgeable about it, and I mean, like I said, so far my recovery has been very easy, and I'm really glad.
I couldn't agree more. I think doing your research is the most important thing you can do. Make sure you're getting this done by a board certified plastic surgeon. Really make sure you feel comfortable with somebody. Make sure you're doing it with the right reasons, and then everything else will kind of take care of itself.
So you think we're ready to jump into fact or fiction?
Yeah, let's do a little fact or fiction. So this is one of my favorite little lightning rounds. So we'll just ask a few little questions here, and we'll see what they say. So, celebrity husband, we'll start with you. Fact or fiction, you dated multiple people in nursing school over the count of 10.
Oh, God. Oh, fact.
Fact. Wow. Oh. This is going to be a rough night for you tonight. Fact or fiction, your wife is a celebrity fashion stylist.
That is a fact.
Fact or fiction, we actually went shopping together.
That is also a fact.
Well, Megan, your turn. You excited?
Yes, I'm definitely excited.
I get a little chuckles thinking about this. Fact or fiction, your goal for 2020 is to get up to a 410.
Yes, it is. Every day. It's not just once, it's every day.
But you're talking 7 days a week, you're going to get up before 10.
10 a.m., yes.
So just to put this in context for the people, what do you do right now?
I mean, every day for me is different, honestly. But that's why, working in media, I can create my own hours. I can do that. So, yeah.
Fact or fiction, you send us a group text most of the time at about 4 a.m. before you're going to bed.
That is definitely fact. And then I'll get a response when you're waking up for the day. So then I know I need to go to bed.
And maybe 2 hours after that, at 5 a.m. when we're waking up. Oh, Megan texts us at 3 a.m.
So fact or fiction, the best time for us to communicate is between 4 a.m. and 6 a.m. because that's when you're going to bed and when the rest of us are getting up.
Waking up.
I would say that's when we're all on the same schedule.
That's exactly right.
Fact.
Well, that is our first episode of Fact or Fiction. I think we're going to do a little something called Behind the Bovie, which is a little something that's Travis's brainchild, because trying to give everybody a little bit of a look behind the scenes.
And I'm going to cut in here. So for everyone who doesn't know at home, what is a bovie? What's the bovie? Explain that.
Yeah, so we were kicking around this idea a little bit, and Megan, stopped us, and thank God she gave us the real life. What is a bovie? It's actually the electric cautery unit, or and again, Megan, what is electric cautery?
So would you expect someone to know that?
So it's actually electricity that's delivered through the tip of almost like a tiny little needle or a
looks like a pin.
It does look like a pin, and that electricity is what we use to zap little bleeders or cauterize little blood vessels that are bleeding in the body. So that's what can make these surgeries seem basically bloodless.
And I get that question all the time on my Instagram, is how come people aren't bleeding? It's because there's something called prospective hemostasis.
Yes.
But we're actually doing this, and this has really changed and made surgery safer. In the past, people needed blood transfusions all the time, especially in our world of aesthetic surgery. That is extraordinarily rare.
Yeah.
And it's because of some of these techniques.
The bovie, completely changed surgery in general, in plastic surgery for sure. But
so now that we know what a bovie is, give us a little behind the bovie, little nugget that people don't know.
People don't know that we listen to music pretty much every time we operate.
Who typically gets to pick the music?
You do in our room. There are some days where I have to put my foot down, and we've got to do something different to change it
I
up.
mean,
You are a creature of habit.
I am a creature of habit, and usually by the 7th time the same song comes on, Travis just at some point just makes the change. He makes an executive decision, and the station gets changed.
And I no hate on Katy Perry at all, but if I have to hear another Katy Perry song, I'll explode. So sometimes we have to mix it up a little bit. But yeah, we listen to music in the OR. A lot of people don't know that. So this segment is basically just going to give you little tidbits of what you guys might not know happens in the operating room.
And then one of the other goals on this, besides just talking about plastic surgery and getting to know us a little bit, is trying to keep stuff a little positive. So I think you're going to do a little quote of the day for us?
Yeah, a little quote of the day. One of my favorite quotes, it is from Abraham Lincoln. It's actually, if you give me 6 hours to chop down a tree, I'll spend the first 4 sharpening my axe. And basically just alluding to preparation is what's going to get you places in life, and why work harder when you can work smarter. That's my
Megan, what's the last thing that you prepared for?
The last thing that I prepared for, man. Probably this today. Showing up on time, making sure that I'm here.
Because we did push her. Just so you
10.
guys know, we made her start before 10. We
Yes.
did. Travis, last thing you prepared for?
I would say this, or sometimes helping Mary, my wife, with some of her blog stuff. We just got back from San Diego a couple weeks ago, and we did a bunch of stuff out there for her blog stuff. So
we do appreciate you working us into your schedule. As between you and Megan, I mean, I think this was the only weekend in 2019 that they were both in town. So we appreciate you guys
We made it
taking
work.
What about
your
you?
one weekend. People may or may not know this, but we're actually in the process of moving into a new building. So it's actually been 1.5 years of preparation to actually make the move. So
That's exciting.
That's a big deal.
super
Very
excited. I just want to sum up a few things, and we did a little bit about breast augmentation, and so I hopefully gave you guys some good tidbits, some good ideas of what to expect, maybe what questions to ask. And so if there's more questions, more things in the future, please hit us up on our handles at Austin Plastic Surgeon, at Megan Parkin,
at Celebrity Anesthesia.
Boom. I wanted to give a quick plug to our next episode, which is going to be all about Botox, and we may or may not have a celebrity guest joining us, so I think you want to stay tuned, see what else is coming up, and so hopefully you'll enjoy that. I also want to give a shout out to Tall Gamer Donald, our producer, who without him we wouldn't have be here today, and so more to come from him, and thank you, Donald. We appreciate you.